Don't miss these 8 early prostate cancer signs. They could save your life. Did you know that prostate cancer is one of the leading causes of cancer-related deaths in men worldwide? The numbers are staggering. 1 in 8 men will be diagnosed with prostate cancer in their lifetime. Every year, more than 1.4 million men receive this diagnosis, and sadly, nearly 375,000 lives are lost to this disease annually. But here's the hopeful part. When caught early, the survival rate skyrockets to nearly 100%. Early detection isn't just important, it's life-saving. Now, let me ask you something. If your body was sending you a distress signal, would you listen? The truth is, prostate cancer doesn't always shout. It whispers. Subtle warning signs often go unnoticed or get dismissed as minor inconveniences. That's why today, we're shining a light on 8 lesser-known early warning signs of prostate cancer that every man, and those who care about him, need to know. And here's another startling fact. While prostate cancer predominantly affects men over 65, younger men aren't exempt. For those with a family history, the risk increases significantly. And for African American men, the likelihood of developing aggressive prostate cancer is an alarming 70% higher than in other groups. Maybe you're thinking, I feel fine. This doesn't apply to me. But here's the thing. Prostate cancer is sneaky. It can develop slowly and silently, revealing itself only when it's harder to treat. By recognizing these early red flags, you can take control, protect your health, and potentially save your life, or the life of someone you love. So, grab a notebook, pay close attention, and stay with me, because what you're about to learn could make all the difference. Let's dive into these crucial signs. You won't want to miss a single one. 1. A weak or interrupted urine stream. One of the earliest signs of prostate cancer is a weak or interrupted urine stream. Normally, urination is a smooth, steady process, but in this case, you may notice your stream is unusually weak or stops and starts before resuming. This occurs because the prostate surrounds the urethra, a key part of the urinary system. When a tumor grows in the prostate, it can press against the urethra, restricting the flow of urine. Picture this. You're standing over the toilet, expecting a normal flow, but instead it's slow, inconsistent, or even stops midstream. You try to push harder only for the flow to falter again. What's worse, it might happen frequently, leaving you frustrated and wondering if it's just a temporary issue. Why should you take this seriously? This symptom could indicate an issue with your prostate that requires immediate attention. While other conditions like benign prostatic hyperplasia, BPH, can cause similar symptoms, it's critical not to assume. Ignoring a weak urine stream could allow prostate cancer to progress unnoticed. If this problem persists, don't wait. It's better to consult a doctor early. They may recommend tests such as a prostate-specific antigen, PSA, test, or imaging to determine the cause. Early medical intervention could lead to a timely diagnosis, possibly saving your life. Never underestimate what your body is trying to tell you. 2. Difficulty. Starting or stopping. Urination. Another early red flag for prostate cancer is difficulty starting or stopping urination. If you find yourself standing over the toilet for what feels like forever before the stream begins, or struggling to finish completely, this could be a sign of an underlying issue with your prostate. Why does this happen? As the prostate grows due to a tumor, it can compress the urethra, making it harder for urine to flow freely. You may also experience lingering dribbles after you think you're done, which can be frustrating and uncomfortable. Imagine holding in your bladder for a long time, finally going to the bathroom, and yet you can barely get the stream started. Or, after you think you're finished, you still feel the need to urinate, but can't empty your bladder fully. These signs might feel like minor inconveniences, but they could indicate something much more serious. While difficulty urinating can also be caused by non-cancerous conditions like benign prostatic hyperplasia, it's essential to treat this symptom seriously. Persistent issues like this can lead to further complications, including urinary retention or infections. If starting or stopping urination has become a regular problem for you, don't hesitate to see a healthcare professional. Early detection of prostate cancer can make all the difference in your treatment options and recovery outcomes. 3. Persistent pelvic discomfort or heaviness. Feeling constant pelvic discomfort or heaviness is another potential early warning sign of prostate cancer. This symptom can manifest as a dull ache, a feeling of pressure, or even mild cramping in the pelvic area. Why does this happen? The prostate is positioned near the pelvic floor, and when a tumor develops, it can cause inflammation or swelling in the surrounding tissues. This inflammation creates a sensation of discomfort or heaviness that doesn't seem to go away, no matter how much you rest or stretch. Consider this. You're sitting at your desk or driving, and you notice a persistent feeling of heaviness in your lower abdomen. It's not painful, but it's there, nagging and distracting. Over time, you might dismiss it as muscle strain or fatigue, but if the sensation persists, it's worth investigating. This symptom is often downplayed, but it's a significant clue that something may be wrong. If this pelvic discomfort is constant and doesn't improve with normal remedies like rest or over-the-counter painkillers, it's time to consult your doctor. Combined with other symptoms, this could point to changes in your prostate that require further evaluation. Early action can help limit the spread of potential prostate issues, including cancer. 4. Burning sensation. During urination. A burning sensation during urination is another warning sign of prostate cancer that's often mistaken for a urinary tract infection, UTI, or another benign condition. This symptom is characterized by a sharp, stinging pain or a lingering discomfort whenever you urinate. But why does it happen? A tumor in the prostate can create inflammation or irritation in the surrounding tissues, including the urethra. This irritation can cause urination to feel painful, similar to a burning sensation. It's not uncommon for this symptom to be sporadic at first, only to become more frequent over time. Imagine you've just finished exercising and go to the bathroom, only to feel an intense burning sensation as you urinate. It catches you off guard, and you assume it's just a passing issue. But then it happens again the next day, and the discomfort starts to linger. That burning sensation could be an early signal of something serious, including prostate cancer. While burning urination is more commonly linked to infections, sexually transmitted diseases, or kidney stones, it's not a symptom to ignore. Persistent burning, especially if it occurs alongside other prostate-related issues, like difficulty urinating or pelvic discomfort, warrants immediate medical attention. Your doctor can perform tests to rule out benign causes or identify early-stage prostate cancer, increasing your chances of effective treatment. 5. Unexplained fatigue or lack of energy. We all feel tired from time to time, but unexplained, persistent fatigue is a symptom that should never be ignored. While it's less commonly associated with prostate cancer, it can be an early warning sign as your body fights off changes caused by the disease. Fatigue related to prostate cancer often feels different from everyday tiredness. It can leave you drained even after a full night's sleep, or make it difficult to complete simple activities, like climbing stairs or concentrating at work. This happens because cancer can disrupt your body's energy production, causing chronic exhaustion or even anemia. Picture this. You wake up feeling as though you didn't sleep at all. Tasks that used to take little effort now feel like monumental challenges. You're not stressed, overworked, or sick, so why are you so tired? If this unexplained fatigue continues without an obvious cause, it's worth a closer look. Persistent fatigue is your body's way of signaling that something isn't right. While it could be linked to other conditions, such as depression or a vitamin deficiency, it's a good idea to consult a doctor if it's unusual for you. When paired with other prostate cancer symptoms, this fatigue becomes an important clue that shouldn't be disregarded. 6. Changes in bowel habits linked to pelvic pressure. Changes in bowel habits, such as unexpected constipation, frequent bowel movements, or a feeling of incomplete evacuation, can also signal early prostate cancer. While it's not a classic symptom, the close proximity of the prostate to the rectum means that any abnormal growth in the prostate can affect bowel function. Why does this happen? A growing tumor in the prostate can create pressure on the rectum, disrupting normal bowel movements. This pressure may lead to a sensation of fullness in the rectal area or difficulty passing stool, even if your diet and hydration remain unchanged. Imagine the discomfort of feeling bloated or backed up, yet unable to fully relieve yourself. That frustrating change could be more than just a digestive issue. For example, you may notice that you're visiting the restroom more frequently but feel like you're not fully emptying your bowels. Or you might struggle with sudden bouts of constipation for no apparent reason. These changes, especially if persistent and unusual for you, shouldn't be ignored. It's easy to dismiss bowel habit changes as a result of stress, poor diet, or lack of exercise. However, if they occur alongside other warning signs, like pelvic discomfort, urinary problems, or unexplained fatigue, it's time to seek medical advice. Early detection of prostate cancer can prevent the condition from advancing and affecting other systems in the body. Don't wait for symptoms to escalate. Listen to your body's signals. 7. Unusual stiffness or tightness in the lower back. Unusual stiffness or tightness in the lower back is a lesser known but important sign of prostate cancer. This symptom is often misattributed to muscle strain, aging, or poor posture, but it can actually indicate cancer that has spread to the bones, particularly the spine. Why the lower back? The prostate is located near the spine, and as cancer progresses, it can spread to nearby bones, causing inflammation, stiffness, or pain. This stiffness may feel different from typical muscle soreness. It might persist longer, worsen over time, or feel especially pronounced in the morning or after periods of inactivity. Consider this scenario. You wake up every morning with tightness in your lower back, thinking it's just from sleeping in a bad position. You stretch, but the discomfort doesn't go away. Over time, it becomes harder to bend, sit comfortably, or perform tasks that used to feel effortless. If this stiffness doesn't improve with rest, stretching, or basic pain relief, it's worth investigating further. Persistent lower back stiffness can also signal that the cancer has metastasized, which requires immediate medical attention. While back pain is common and often unrelated to cancer, you should never dismiss persistent or unusual symptoms, particularly if you're experiencing additional signs like pelvic pain or urinary difficulties. Seeking an evaluation now could prevent complications later, so don't delay. 8. Difficulty. Maintaining an erection. Difficulty maintaining an erection, also known as erectile dysfunction, ED, is a deeply personal and often stigmatized symptom, but it can be an early sign of prostate cancer. While many men experience ED due to stress, aging, or other health conditions, prostate cancer can directly interfere with this function. Why does this happen? The nerves and blood vessels responsible for achieving and maintaining an erection run very close to the prostate. When a tumor develops, it can compress these nerves or disrupt blood flow, making it harder to achieve a firm erection or sustain it long enough for sexual activity. Imagine this. You start noticing that intimacy has become more difficult. Perhaps achieving an erection takes more effort, or maintaining one feels like a struggle. While it's tempting to attribute this to exhaustion or emotional factors, recurring problems with erectile function could signal an issue with your prostate. Erectile dysfunction caused by prostate cancer isn't always isolated. It may occur in tandem with other symptoms like urinary issues or pelvic discomfort. It's important to recognize this as a potential flag for something more serious. Many men feel embarrassed or reluctant to discuss ED with a doctor, but it's crucial to address these concerns openly. Early detection of prostate cancer often leads to better treatment options and outcomes. Remember, seeking help isn't just about improving your quality of life. It could be the key to saving it. Prostate cancer is serious, but the power of early detection is in your hands. If you or someone you know is experiencing any of these warning signs, don't wait. Reach out to a doctor. Your health is priceless. And before you go, help us spread this important message by liking this video, sharing it with someone who might need to see it, and subscribing to our channel for more life-saving health tips. Let's work together to raise awareness and save lives. Thank you for watching, and take care of yourself.